health.
You don't have to touch him or her.
We touch, we talk, we touch a lot to the patient. We touch, we talk, and then we assess that, well, this is a man of this type, this kind of temperament, and he has so much of health and vitality. Then comes the second part of examination, where we emphasize the disease, from which disease is suffering, how much is the disease, and all this. So we call it Roga Pariksha and Rogi Pariksha, examination of the man and examination of the disease from which the man is suffering. This is how we differentiate. And for this, we ask questions, we touch, and we see different parts of the body. For example, in order to decide the vitality and temperament, we do Prakriti Pariksha. It is called Prakriti Pariksha. Prakriti means the temperament of the man. There is an elaborate method for this. Similarly, for disease, several things we do. Most important is the examination of the pulse. We read the pulse, because this pulse represents the entire body, also the influence of mind, also the influence of the senses. So we examine the pulse, and this gives us a lot of information about the disease. We don't use a lot of machines. Now in the modern medicine, there are a lot of sophisticated gadgets to identify the changes in your body, all that. We don't do. We more talk to the patient, touch his body, his pulse, his tongue, his eyes, his face, his urine, his feces. We are more near to the patient. The basic theme of Ayurveda, any clinical examination, is that the physician and the patient become one. It's nearer. This is the basic approach of Ayurveda.
And then how do you cure the patients?
Well, for curing, we have two fundamental approaches, two fundamental methodology. Number one, Ayurveda says that the body, when it is sick, is very dirty. Dirty means biologically dirty. Every cell of the body has become dirty because of many metabolites in the system. So there is a need of purifying it. Purify from outside, skin, the gross channels like gastrointestinal tract and other things. Then going this process of cleaning up to the molecular level. There are methods for this, that you clean even the cell membrane. So whole body should be clean, so that whatever medicine you give is easily flowing in the body. Whatever food you give easily flows in the body. And whatever bad is in the body easily goes out. Now this kind of approach is called purificatory treatment in Ayurveda, which is very popularly known as Panchakarma. Pancha means 5, karma means therapies. We have 5 kinds of methods for purifying the body. This we do, number one. When we feel the body is clean, then we give palliative therapies. Palliative means we use drugs, then diets, exercise, yoga, whatever you can do to rectify the imbalance. This is how we do. Purify and then palliate, and so that the homeostasis is more in balanced state.
Do you deal with the chakras?
Not so much in Ayurveda. Chakras comes more in the field of yoga.
I see. So it's a very complex method you use with healing, curing people.
It looks complicated when I'm talking, but it is not so complex. When the patient comes to you, for me, I work in a hospital, big hospital, where there are 1,000 beds and 200 beds only for Ayurvedic treatment. There are large number of patients. We take the patient, examine them, and depending upon the condition, we send them to Panchakarma therapy, where they are given some purificatory treatments for a few days. And then they come and we prescribe some medicines in the same way as any doctor does. Some medicines, some special diet, also some exercise, and this goes on. The process is a little slow. It's not a quick medicine that you give a pill and the patient is okay, not this. Our process is slow, soft, harmless, rejuvenating, restoring. This is our approach.
How successful is Ayurveda?
I should say it's very successful if we have all the things to do. In many Ayurvedic hospitals, there is no facility for Panchakarma, for example. They treat without Panchakarma, so result may be less. but it is very successful in certain problems. Maybe that all problems cannot be tackled by Ayurveda even today. For example, very acute diseases, acute infections, we don't treat. We refer them to modern hospitals. Most of the surgical problems we avoid. We send them to the modern hospitals. But most of the chronic diseases, psychosomatic diseases, mental health problems, gastrointestinal diseases, the lipid disorders, stress problems, these are the areas where modern medicine is very weak even today. In spite of all advancement, it is very weak. And these are the areas where Ayurveda can do much better.
How about the fatal diseases like cancer or AIDS?
About AIDS, we have no experience because AIDS is a new disease. So at least I have no experience of, even because in India AIDS is just a name. It's very, very rare. So, I have not seen a case of AIDS in India. Cancer is of course there. And there are no specific remedies for treating cancer. But because every cancer has a problem of immune deficiency, immunological deficiency, number one, all are under stress. So there is a possibility that Ayurveda can be a complementary treatment for patients of cancer. Many patients of cancer who are under treatment in our hospital, we give them complementary treatment to improve the quality of their life. We don't claim that we can cure cancer at this moment of time. But there are a number of doctors in India and also abroad who are screening many Ayurvedic drugs for their anti-cancer activity. A group of doctors in Holland are screening a number of Ayurvedic drugs for anti-cancer effect. I am one of the collaborators with them. And they have reported that some of these drugs have anti-cancer activity. But all this is in the phase of development.
Could Ayurveda be a preventative method as well?
Yes. Ayurveda, as I said in the beginning also, Ayurveda can be a promotive medicine. Means it will be a method of promoting health of even normal people. Then it can be good to prevent many problems. And thirdly, curative. In fact, Ayurveda is more a preventive and promotive medicine than curative. There is an elaborate system of preventive and promotive medicine which we call as Swasthavritta. When we teach our students, we teach a subject called Swasthavritta. It's a big subject where we teach how to eat, how to live, all these things as a system of promotion and prevention.
Well, sir, thank you very much for the conversation.
Thank you.